My name's Johnny, and I'm going to be talking about a pregnancy issue called ectopic pregnancy. So during an ectopic pregnancy, basically what happens is the fertilized eggs does not get fertilized in the uterus where it's supposed to, and instead it can be fertilized somewhere outside the uterus. In most cases, about 90% of ectopic pregnancies happen outside in the fallopian tubes. And some things that can happen are internal bleeding and for infertility and even death. Now, during pregnancy, the eggs, they leave the ovaries and during the woman's menstrual cycle. And once they're released from the ovaries, they travel down the fallopian tubes. Now, when an egg is fertilized, this typically happens when the semen travels up the uterus into the fallopian tubes while the egg is still traveling down the fallopian tubes. And 9 times out of this is usually when the egg gets fertilized. And in a healthy pregnancy, the egg travels down to the uterus and gets implanted into the walls of the uterus. So what happens during the ectopic pregnancies are the fallopian tube is that the egg gets implanted in the fallopian tube instead of getting implanted into the walls of the uterus. Again, this is not the only place it can happen, but this is one of the most common places where it does happen. So some signs and symptoms that you're experiencing in ectopic pregnancy. Some symptoms are going to be vaginal bleeding, pain in the lower abdomen, pelvis, and lower back, dizziness, weakness, fainting, and low blood pressure. On top of that, there's a few ways to test for it. You're going to have some urine tests. There will be some blood tests where they see if you have a low amount of human chronic gonadotropin, HCG. And of course, an ultrasound helps see where that egg was implanted. And here's my works cited. And finally, my paragraph. One of the reasons I chose this, just because it's something that doesn't really get talked about too much, and it's very, very rare. Only about 3 to 2% of all pregnancies happen to be an ectopic pregnancy. And mainly, I just wanted to mention what are the risk factors that put you at risk of having an ectopic pregnancy. And so some of these risk factors are, it can be your age if you're over the age of 35, if you've had a history of miscarriage, if you use in vitro fertilization, if you have a history of pelvic inflammatory disease or any scar tissue from any surgeries. And then finally, the big risk factors are if you have had certain STIs or if you have an IUD in place during the time of conception. And it is a serious matter, and it should be taken seriously. And healthcare providers need to treat it right away, because if left untreated, the woman can experience infertility, internal bleeding, and possibly death.